Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we've been talking about tics and twitches, which are involuntary muscle contractions that over time can be disruptive. Express Care's Dr. Jitka Lom is here, fortunately, to answer some viewer questions on the topic, so let's get to those. Jonathan from Jico asks, can caffeine make my tics worse?
I think so, yeah. Anything that sort of revs you up a little bit like that, caffeine, energy drinks, can definitely make tics worse. Yeah, avoid it.
Sarah from Manila asks, my left eye twitches. Is it true that injecting a small quantity of Botox in the muscles around the eye could help me stop twitching?
Yes, it can, and that's a very effective treatment. Basically, tiny doses of the medication weaken the muscle, and then when it tries to twitch, it's not really making the motion as much, and it'll calm it down. They'll still twitch a little bit, but it'll be much less visible and much less annoying to the person.
So no more twitches and no more wrinkles.
Yeah, 2 for 1.
So it's a 2-in-1, yes. James from Sinahanya asks, can a lack of potassium cause muscle twitches? If so, why?
It can do that. Low potassium can certainly do that. A situation where that might happen is in dehydration with diarrhea or something like that, vomiting, or certain endocrine disorders, yes. And the reason is because part of the calcium balance that we have in the muscles is also linked to the potassium that we have around our cells. And there's an in and out motion of those two ions that go into our cells. So if you're low on it, there's a leakage out of your cells, and you can fire off your muscles, basically. So it can happen.
So I meant to ask you in the last batch of questions, can avoiding certain foods or eating certain kinds of foods help with prevention?
I don't think so. It's, you know, I think the only thing I could think of there would be caffeine, avoiding that.
Okay, sounds good. And Paul from Agate asks, I have some regular twitches. When should I get checked for possible Tourette's?
Well, Tourette's has a whole bunch of different classification or criteria that you need to meet to have that. But if you have a bunch of different tics, there are certain other movement disorders that you should be checked for, and seeing a neurologist would be important. The hallmark of Tourette's tends to be the verbal or the vocalizations that people do.
And I meant to ask you, how does a doctor diagnose somebody as having Tourette's or a tic syndrome?
Well, usually they'll do a full neurological examination, make sure that all parts of the brain and the nervous system on examination are pretty normal. Sometimes they'll get a CT scan or an MRI of the brain to make sure that there is no tumor, because occasionally something like that can cause this problem. And sometimes they'll get what's called an EEG, which is a special test of the brain wave electricity to see whether there is actually an underlying seizure disorder, because that can also happen. But most of the time, if all of that comes back normal and it's basically a twitch or a tic like that, then it's the process of elimination that will tell you that.
Okay, and our last question comes from Megan from Dedido. She has a 3-year-old daughter, and she notices that her body twitches when she sleeps. What is causing this, and what should she do?
That's really good. Yeah, as long as it's just a simple twitch, like jerking legs or something like that during the sleep, and it's intermittent and there's no pattern to it, then it's almost certainly not a seizure. And it's related to the deep REM sleep. That's the deepest level of sleep that we go to at nighttime when we're dreaming. And during those dreams, we're actually acting out certain events. So we might be chasing something, or we might be you know, throwing a ball or doing anything like that, and our muscles while we're sleeping will be acting that out as well. So that's when sleepwalking occurs as well. That would be an extreme muscle movement during REM sleep.
Okay, interesting. All right, any last advice or wisdom that you'd like to share on this issue?
Well, when you asked earlier about what to do if you see somebody with a twitch or a tic, you know, one way you'll tend to want to stare at the tic, right? You see, what is that person doing? They're constantly moving their eye or whatever. And a trick for that is to intentionally look at the other side of the face or at another part of the person's body, so that you're not staring at that that portion of the body that may be very embarrassing for that person. And that goes the same for if somebody has a, eye disorder or a, blindness in one eye. Try to look at another part of the person's body so you're not embarrassing them.
Okay, good to know. Well, thank you as always for coming
Sure.
in. We look forward always to having you in the studio. Dr. Lom will be back again in the studio next week when we will be talking about ADHD. That's Attention Deficit Hyperactivity Disorder. If you have any questions, you can send them to us at healthyliving@kuam.com. The Sanitation Inspection Report and details about Cervical Cancer Month is on the way. Stay with us.